This is the second program that we've had to try to bring you as much information as we can on the changes brought about by the Affordable Care Act. Our thanks to Mercer for putting the program together. We have a mic set up for Q&A that we will have at the end of the program. So if you have any questions, if you could please just line up. We're taping the program, except for the United Healthcare's portion. They do not want to be taped or have their material distributed. No fault of Nicholas, though, but I just want everyone to be aware of that. Okay, well, it's just me. It's not that important, but they'll speak louder. So that's it. Without further ado, I introduce you to Frank Blackwell from Mercer.
Good morning. I think I'm probably loud enough. Okay. Thank you very much for having me this morning and braving the conditions to get out. Basically today, what I'd like to do is talk about what the Affordable Care Act means to you, and not only to the members of the audience, but to the 24,000 members of the city bar, because this is such a far-reaching and all-encompassing change in our healthcare system. Today we've got 4 people speaking. Not going to read the bios. I've spent 30 years in the insurance business. I actually started out in the insurance business with Home Life Insurance Company of New York a long time ago, and at that time, one of the lessons that we learned was that Washington, D.C. might be the capital of the U.S., but when it comes to insurance, New York is the capital. So many of the reforms that have occurred nationwide have really started in New York. I look at a lot of things that are in the act. Hopefully today we'll. Whenever I go to these meetings, normally they kind of come from a 10,000-mile view down. And what I'd like to do is start at each person at the individual level. I'm basically going to address, first of all, the individual mandate, the tax credits involved with that, the New York State of Health Exchange, just speak briefly about the sponsored plans of the bar. Then we'll have Oxford and Empire make a presentation about their products and issues, and then we'll have a question and answer session, which I'm sure will be lively. Okay, so everyone, the Affordable Care Act is basically and it's a series of, I'm going to say carrots, the old carrot and stick. And if we start out at what it means to you, I don't care what age you are, we basically have a charge that we need to have insurance. Everyone has to have something called minimum essential coverage by April 1, 2014. That's the end of the open enrollment period, or you're going to pay a penalty. And I pulled out from a congressional report where they talk about if you're unable to pay a penalty but fail to do so, you'll receive a notice from the IRS. And I want to just start this out by saying this act is an intersection of health insurance and tax, and I'm certainly not an attorney. I'm not an attorney, but I'm also not an accountant. So I'm never going to calculate a tax for everyone. I'm simply going to make you aware of the issues. But it seems that there will be, even though there is a connection to tax, that it's not going to be the conventional issues that you have with tax. So that there's, if you fail to pay the penalty, it's going to be reduce your future tax amounts, or but it's not going to be subject to criminal prosecution, which I think realistically doesn't make it any less onerous. I mean, you're going to have to pay. Minimum essential coverage basically is any of these items that are listed here. Medicare Part A. So if you're over 65 and you're eligible for Medicare, Medicare is, of course, Parts A, Part B, Part D. As long as you have Part A, you will not be subject to a penalty. If you're also enrolled in a Medicare Advantage plan, you're not subject to the penalty. Medicare Advantage, of course, is an HMO type coverage for Medicare beneficiaries. You're covered by Medicaid in the various states. State Children's Health Insurance Program, TRICARE, which is the military, VA, Peace Corps, employer-sponsored plans, plans in the individual market, which we had quite a vigorous discussion before the meeting about, and we'll certainly address that and get there. Grandfathered health plans, plans that were in existence before 2010. Self-funded student health plans, refugee medical assistance, state health benefits, any other coverage the House and Human Services Secretary recognizes. I think the important thing to remember is that what they've done is they've taken this idea of you have to have a certain minimum level of benefits, and that all these places you can get it have to meet the qualifications of offering minimum benefits. We'll see in the carrier presentations where they talk about the specifics of what that package looks like. Because minimum essential coverage must include essential benefits. So that basically no matter where you get your insurance, if it's a health plan that's offered, from an employer, if it's offered as an individual basis or by Medicare, it's going to include these services that are listed. And when I look at the New York market, particularly in the Healthy Families program and some of those programs, there were perhaps I guess we'll call them holes in coverage or things that weren't covered. And for example, and another, obviously, mental health and substance abuse is now covered the same as any other benefit nationwide. And I think in New York, this was not as big an issue as it was in other states where you had policies that were offered that really, it's kind of like the lottery. Well, I have a cancer policy, but if I need back surgery, it's not going to cover me. So I think the important thing to remember is that when you buy a health plan today under the Affordable Care Act, that it will be compliant with this idea that, let me go back, that you have a real health plan. So one of the focuses is on the actual health plan itself. And as we move along with this, I know that the big concern of most folks in the room are the network of physicians that you're able to use. And there really isn't a whole lot in the Affordable Care Act that guarantees access to your physician. Most of the attention is given to health plans and their rules. Now, if you don't have minimum essential coverage, you have to pay a penalty. And I've been looking at this penalty for a couple years, and I used to always stop on, if we go to the next line, we'll go back. I used to see, oh, it's going to be $95 if you don't have minimum essential coverage, and I always went, who cares? And then, as we got a little closer, I came to realize that it's not only $95, it's this year 1% of your income above your filing threshold for that year. And once again, and that's your personal exemption amount plus the standard deduction amount. Once again, I'm not an accountant, but when I look that up for a family of 4, it's about normally around $20,000. So if you're thinking about what your penalty is going to be, you subtract your total income from your tax filing threshold. Once again, call up your accountant to find out what that is. and it's 1% of that. So if we just think about this in a general sense, if you make $100,000, you're probably looking at about an $800 penalty. So it's not $95 as I kind of thought all along. So, and as you can see, that's increasing rather rapidly. So there is a real penalty if you don't have insurance. And of course, the idea of that is that we're trying to encourage everyone to have adequate health coverage. And the penalty is capped at 300% of the annual flat dollar amount. So, so if you have a family of 4, you have to do that calculation again. But it's if you're up at 200,000 of income, you're gonna get capped. But if you're lower than that, you're going to be at the percentage. Okay, folks who are not subject to the tax penalty, if you have a religious exemption, and that's specified there in the code, if you're undocumented, you're not subject to the penalty. And if one of the objectives is to cover as many people in America as possible, to me this is quite a large hole in that objective. Certainly there's an undocumented population in New York, and out in California it's very substantial. So that's a lot of folks who are not subject to the mandate. If you're in jail now, you don't have to buy insurance. There is an affordability test as well. If your contribution towards a health plan exceeds 8% of your income, you can ask for a financial hardship exemption from the penalty. Once again, that's something to ask your tax advisor about. If you have a gap in coverage less than 3 months, so in essence, you need to be covered 9 months during the year to avoid the penalty. If you're a Native American, and there's a real set of criteria they use to determine whether you're Native American, you're not subject, and if you don't file a tax return. Okay, so that's the mandate. It's the sort of the stick part. If you don't have insurance, we're going to give you a penalty. On the plus side of things, and I don't know how many people in the room are parents, but I think we know psychologically that we can stop behaviors through negative means, which a penalty would be. But to create the behaviors that we want, it's necessary to use positive reinforcement. So the tax credits are a method by which there is an encouragement to purchase insurance. Let's look at that a little bit. One of the most common questions I get is, do I have to buy my insurance through the exchange? And normally it's kind of asked, well, I have to buy my insurance through Obamacare. Under the Affordable Care Act in 2014, if you are seeking a tax credit or financial assistance, it has to come through the exchange, both as an individual or as a group. If you're an individual and a family, it's a subsidy towards your insurance premium, and it's directly paid to the insurance company or HMO to reduce the premium. And in a subsequent slide, we'll look at that a little more closely. It's available for folks with incomes between 138% and 400% of the federal poverty level. And it's a sliding scale paid directly to insurers to help pay for insurance. And the credit calculation is based on the second lowest cost silver plan. So when they calculate how much of a credit you're going to get, they use a silver plan. We'll talk about that in a subsequent slide. But the credit is applied to all plans. It's not just applied to the silver plan. An interesting factor in this is that when you go to the New York State of Health, you're allowed to say, I want the credit to be applied immediately, or I want a partial credit to be applied, or I don't want any credit to be applied. I'll take it as a tax credit. I'll take it on my tax return at the end of the year. So there are some options in the way you can allocate that tax credit. I think most people at these income levels are going to want the subsidy up front. In order to qualify for a tax credit as an individual, you must not have access to affordable and minimum essential coverage through an employer. And this is something that I think is not really well known. When you go to the New York State of Health and you apply, one of the questions they ask you is, are you covered by an employer plan? And if you are not eligible for a credit. I find this somewhat discriminatory. The way they calculate and the way they determine whether your employer insurance is affordable, it's first of all, because your employer is offering it and it's 2014, it's going to meet the minimum essential coverage standards. However, you are at the end. Let me rephrase that. When you apply, they ask you, does the insurance from your employer cost more than 9.5% of your wages? So it's very typical these days that employers will pay at least part of the cost for employee coverage, but very little towards dependent coverage. So it's a situation where the employee has access to, the employer contribution doesn't cost them 9.5% of their income. So if they're making $100,000, does it cost that employee $10,000 to get their insurance? But it does not factor in the dependent cost. So really, virtually everyone that has access to employer-sponsored insurance is going to be ineligible for a tax credit. Is the bottom line on that. And if you want to find out what exactly you're eligible for a subsidy, there's a New York State of Health premium estimator where you plug in your income, and then it shows you what your tax credit would be. You know what, I'm going to address the sole proprietor issue, but you would have to be an employee of the company to say you have access. So if you're a sole proprietor, and as we move along with this, under the current regulations, a sole proprietor is not considered an employer. Just so you know, I mean, I hear these federal poverty levels, and I said, well, what are the actual federal poverty level guidelines there? And I'll let you do the math. It's up to 4 times that you could be eligible for a subsidy. So if you have a family of 4, 4 times 23,850 would be the maximum you could make and qualify for any subsidy. Okay. Now, I don't want to go through this chart and calculate everything. The purpose of this is that when the Affordable Care Act was designed, they wanted to create affordability for folks. So the way they felt would be best to do that would be to look at these various income levels and say that the premium can't exceed this amount based upon those income levels. And this is obviously a graduated system. As you are closer, when you're at a lower poverty level, your amount of income the amount of premium as a percentage of income you need to pay is lower. So if I'm at 138% of the federal poverty level, I'm going to pay 3% of my income as premium. If I'm at 400% of the federal poverty level, it's all set up that you pay 9.5% of your 9.5% of your income as premium. And I tell you, you look at the numbers, if you're at 400% of federal poverty level, that's not super affordable. So there isn't a lot of relief for folks who are over the 400% level, but certainly if you're falling in these other categories, there's quite a bit of relief and assistance, and there'll be a subsequent slide where I show the amounts. Yes?
Is there a distinction between whether it's a couple is filing jointly or separately?
Better talk to your accountant. Because what happens is, what they use is your modified adjusted gross income, and it's the total family income. And so you need to get that number from your accountant. What is your modified adjusted gross income? And so that your filing status is going to affect, what that is for your family. So as an example here, I've got a married couple with 2 children, earning 47. Oh, let me look here. I can't see over there. 47,100 annually, which is 200% of the federal poverty level. The annual premium for the second lowest cost silver plan is $10,000 annually. The tax credit equals $10,000 minus $2,968, which is 6.3% of $47,100. I mean, that's kind of a complicated calculation, but the 6.3% matches up with the top of the chart there, the 200% federal poverty level. So the most that this person is responsible for paying is 6.3% of their income. However, the premium that the insurance company or the HMO wants to charge is $10,000. But based upon this chart, they're not allowed or supposed to pay more than 6.3% of their income, which is the $2,968. So they're going to receive $7,032 as a premium tax credit and have to come out of pocket $2,968. And that's basically, when you go to the New York State of Health calculator, that's what that calculator is doing. Yes? That is, yes. That's whatever that number is. And, believe me, this is quite a scary situation for insurance people, because all of a sudden I'm dealing with folks about their taxes, which is a very uncomfortable situation, because I'm certainly not a tax expert. But I have identified that is the number that they use. So that's individual and families. If we move to the employers, and we'll talk a little bit more about the definition of employer in subsequent slides. And by the way, this tax credit's been out for quite a few years. I think it started in 2011. And as opposed to the, so it's basically, there's, if you have under 50 lives, and you as an employer provide 50% of the cost of the healthcare coverage, and the max, and then you have to have, so 50 lives puts you in the small business market. And for purposes of the credit, you need the maximum credit's available to 25 full-time employees or less. You don't count the owners and the partners. And if the annual average wages, excluding the owners and the partners, is less than $50,000, you qualify for the credit. Now, right now, in prior years, that was 35%. In 2014, this is moving up to 50% for for-profit employers. Once again, you have to use the exchange in order to get the credit. And once again, it's a very good question for your accountant. Is this valuable for me? Because as opposed to the individual and family credit, this one really is done on your tax return. So they don't take the credit and apply it to your premium directly. So it's firmly in the realm of tax. Now, this goes to the question that was raised earlier about who's an employee. Purely for purposes of this credit, the following individuals are not considered employees. And it's quite a list. Owners of the small business, such as sole proprietors, partners, shareholders owning more than 2% of an S corporation or more than 5% of a C corporation. Spouses of these owners and family members, which include child, grandchild, sibling, step-sibling, parent, ancestor for parent, step-parent, niece, nephew, uncle. So you can't put the family in there, basically, for purposes of the credit. And this is not exactly the definition that is used to define a small employer, but this is the definition that's used to define who's eligible for the tax credit. So one of the issues we have with the New York City Bar is the fact that we have so many sole proprietors in the program that in the past have been considered groups. And I think in the movement of the Affordable Care Act to have uniformity across all states, that definition of what's an employer has changed, and this is partially a driving force for it. Who's an employee? So a sole proprietor is not considered an employee of themselves for purposes of this tax credit, nor are they now considered a group. Okay. Let's talk about the New York State of Health. And I have to put exchange at the end. I don't know, when I say New York State of Health, it just doesn't sound right to me, even though that's the official name. Okay, I'm going to spend a little time on this slide because there's a lot of information on here. The essential benefit package for New York was the Oxford EPO small group plan, which that became the basis to establish these actuarial values. And this idea of actuarial value, at one point in my life I thought about being an actuary, but I've never really seen it applied to the health plan world. Actuarial value is reflected in the various metal levels: platinum, gold, silver, bronze. Platinum means that the plan is going to pay 90% of your projected health care expenses that year, and the person covered is expected to pay 10%. And that moves down in 10% increments to bronze, which is 60% paid by the plan and 40% paid by the enrollee. As I said, that's kind of a weird concept to me, and I've never really used that in all my years of working with health insurance plans. But the purpose is that at these metal levels, they're trying to create a commodification of health plans. So that if you're looking at the health plan and looking strictly at the benefits, and when we're working with health insurance, I have to keep 3 balls in the air at all times. What's the rate? What's the benefit? And who can I go see? And as we all know, the who can I go see is an issue for sole proprietors now, but we've got to keep these 3 balls in the air. New York is community rated, open enrollment, so the rates are, very apparent. The benefits, have always been a little tricky. When you're trying to compare across companies and you're like, are these benefits the same? Are they not the same? The idea of this is that if you get a platinum plan on the exchange, off the exchange, in the individual market, in the group market, that you can feel confident that it's a good plan. It's a platinum plan. So you don't have to dig through all the benefits as much as we had to in the old days to determine, to compare plans. So if I have a platinum plan over here that costs $100 and one over here that costs $50, we can be assured from a benefit standpoint only that these are comparable plans, very close to equivalent. And you have to be within a very narrow range of 90%. One plan can't be very close to 100% and another 91%. There's a range. So you can feel very confident that if you're shopping for insurance and you're looking solely at the benefits and the rates, that a platinum plan from any carrier is going to be the same or equivalent, very close to equivalent. Now, when the Affordable Care Act first passed, the biggest push certainly was to cover the uninsured. And in New York State, there's approximately 2.7 million uninsured folks. And the primary purpose of the exchange was to offer a venue in which people who perhaps didn't have great means but would be subject to the penalty would have the opportunity to buy insurance, health insurance. Part of that was the projection of these gold levels out into the private market, so that when somebody went to the exchange, they weren't comparing what they called a platinum plan on the exchange to whatever name we want to call Metro EPO or whatever it is off the exchange. So I would call that market reform in trying to help the consumer to be able to feel confident about their plan benefits. And I think a lot of the problems that really the carriers face, that we as brokers face, have come about because this required an absolute revamping of all the plans to meet these metal levels. And it's been quite a confusing and an arduous process. But I think in the long term, once we kind of get used to that and a few years down the road, we'll just feel like, hey, I have a platinum plan. And you're going to know, hey, I've got a good plan. Yes?
How does the percentage that the expenses covered play in with deductibles? Like if it's a 90% covered plan, do you still have deductibles for office visits or is that?
Yeah. Yeah, okay. And here's the standard. So a platinum plan is going to be a zero deductible, and some of them I see are $250. So there's a little bit of wiggle room in there to play with the benefits, but in general, a platinum plan is going to be zero or very low deductible, and it's kind of like Back to the Future to me, because when I first started in this business, I was selling $50 deductible plans, and in the last few years, I think my typical employer deductible's been $1,000. Yes. Yes, they are. Are health savings accounts allowed? Yes, they are. Yes, they are. Let me go. Let me go back here. We can. This will be posted on the website. These presentations being videotaped, and it'll be on the website. New York City Bar. Yeah. Yes.
Does the exchange offer the so-called high deductible plan?
Yes. Catastrophic coverage, they call that. Yeah. Yes.
Are drugs standardized to prescription drugs, or is there more variation on the plans? Are you going to get to that issue?
There's a lot more standardization, but I would not call it 100% standardized from what I've seen. This is a slightly different issue, and we'll come to that. Oxford will speak about their plans. Yes. No. Yes, there's actually something called the catastrophic plan in there. Excuse me? How do you find it?
The catastrophic plan, no, I'm sorry, but the catastrophic plan typically is it's only available to under
Certain
age
ages.
20, I think it is.
Yeah.
And so the bronze level plan would be the higher deductible plan. So the lower, in the metal levels, you're going to have the higher deductible.
Yeah.
And that's what that bronze plan is.
Yes. And you know what? I just had a request. If we could, because we're going to cover a lot of ground, if we could hold the questions till at the end, and I think that way we'll move along. Yeah, I'm coming to it. Here's the both in the individual and the shop market. This is the standard plan design. So that puts benefits to the metal levels. Okay, and could you ask that again at the end, I think? And ask that again at the end, and certainly, you know, our carrier partners will be able to address that directly. Okay. Let me just spend a couple minutes talking about the SHOP program, which I had to remember what the acronym meant, the Small Business Health Options Program. Once again, if you are a small business and you're looking for the tax credit, you have to go through the New York State of Health. And I go through that again. You have to have fewer than 25 full-time employees and pay annual wages averaging less than $50,000. There's, once again, what the actual credit is, 50%. The plan designs are very uniform, individual, employer-based. So once again, we can kind of throw out the whole plan design question. If I see a platinum plan, it's going to be a good plan, and with all due deference to the question about whether this is subject or not subject, I think we can feel very confident, you know, about a plan at a certain metal level is going to be very comparable to another company's plan at the same metal level. I'm not super impressed with the options in the SHOP program in New York. I don't know how viable it's going to be. My advice is, if you have a small business, that you do ask your accountant as to whether these tax credits would be valuable for you. We've looked at this chart a couple times. Catastrophic there at the end that was asked about, the high deductible specifically. You know, basically, as you move down the metal levels, the benefits become less and less and less rich. Now, I don't know about you, but I know for years, and I even though I'm an insurance professional, I would go to my auto insurance broker, and I'd say, I want the minimum. So the minimum is bronze. So if you're simply looking to avoid the penalty and say I have insurance, aside from all the reasons we should have health insurance, you know, the bronze level is the minimum level.
The catastrophic does not avoid penalty.
Oh, yes, it does. Yes, it does. But it's only available to some folks. For most of us, bronze is going to be the answer. I'm sorry, I can't remember. It's
subject to a certain age requirement.
Yeah, it's age
I
and-
believe the age requirement is you have to be in your 20s or younger. That's not definite, but I know it's in that range. So it's really meant for younger folks who really don't need coverage as much, and this is kind of, as it's labeled, a catastrophic plan. But for most people, if you're looking for a higher deductible, the bronze would really be your best option.
Correct. Okay. In the SHOP, these are the carriers and the metal levels of the plans that they have. We notice we have Oxford in there. You know, I don't know. It's a restaurant. It's not the greatest menu, but that's my opinion. Okay. We're going to go backwards here to an individual. So this chart is with regards to an individual and family going to the New York State of Health and trying to purchase their health insurance. So this is, you know, I didn't put it on the slide, but I believe this is the silver level. So this is a family of four, annual taxable income of $95,000. When you work out the federal poverty level times 4, that's slightly above that. So it exceeds the 400% of federal poverty. So there is no subsidy. So this would be, I'd call the street price. As you can see, for a family of 4, it's not the cheapest thing I've ever seen. And we can see the carriers that are available inside of the exchange: Affinity, Emblem, Empire, Fidelis, Health Republic, Health First, Metro Plus, Oscar, United Health. Now, once again, you don't have to buy these plans through the exchange necessarily. They are available off the exchange at this price. But this gives you an idea of the full price. So if I look at a second family that's making $50,000 that qualifies for a subsidy, with the exact same plan designs, they're eligible for a $645 per month subsidy, which you can see the final prices there at the bottom. And if the idea is to make it more affordable, that certainly accomplished that. So the first, this slide, basically these plans and these prices should be available in the open market. But to get your insurance at these prices, you need to have the subsidy, and you need to use the New York State of Health. So at this point, they're not very broker-friendly over there, so there's not a whole lot of assistance that we can give you. I think as we move along, probably next year there'll be a little more broker-friendly. That's the way I've seen these things evolve in the past. I think we're presenting this simply to let you know that this is available, and that if this situation fits your, if this scenario fits your situation, certainly something you should investigate. Questions at the end, please. And you can determine this, first of all, by going to New York State of Health and going through the enrollment process, or by figuring out what your subsidy is through that calculator that I mentioned earlier. And obviously, everyone's scenario is going to be a little bit different, and your subsidy is going to vary. Okay, let's talk about sole proprietors a little bit. I dug up blueprint summary for the SHOP program that was newyork.gov, where they discuss the issue of sole proprietors. So consistent with federal requirements, sole proprietors will purchase coverage through the individual exchange. This is them talking, not me. There are nearly 1.1 million sole proprietors in the state of New York, 1.1 million, of which 23% are uninsured and 14% are insured in the non-group market. 23% of sole proprietors have income below 139% of federal poverty level, and 34% of sole proprietors have incomes between 139 and 399% of federal poverty level, and would be income eligible for insurance affordability programs when available in 2014. This was written back in 2012. Consequently, the individual exchange will enable these sole proprietors to access affordable comprehensive health insurance. Now, those are their words, not mine. I think we have a real, as we're trying to create uniform programs across the union in all states, we're coming to a more consistent definition of what constitutes an employer group. And fortunately or unfortunately, I think unfortunately really, the sole proprietors, well, I think fortunately in the past, sole proprietors have been defined differently in New York than in most states, where you've been able to access the group health insurance markets. I think perhaps an unintended consequence of the Affordable Care Act is the definition of what constitutes an employer. To make it consistent, a single individual without employees is no longer considered an employer or a group. And I know that's caused a lot of consternation and hardship for a lot of you. Believe me, it's not the way Mercer wants it. It's not the way the bar wants it. And I know there's been a lot of efforts to try to obviate this situation, but I think it's pretty clear under the Affordable Care Act that a single individual without employees is no longer considered an employer and has to access the individual market. And I think Part of this is in order to create a risk pool in the individual market that is of adequate size, it's important that more people move to the individual market from the insurance company standpoint, not certainly from where we sit here at the bar. And once again, I know that's been a hardship for a lot of people, but it's really making the definition of an employer consistent nationwide. So, we have quite a few people who are involved currently with the City Bar Health Plan, and we are still mapping out the exact strategy that we're going to use to accomplish this task of getting folks into the appropriate market, whether you are an employer or whether you are a sole proprietor. And what I can say for certain is that we're going to have a methodology by which you will have to requalify as a group if you are indeed a group, which includes your tax ID, listing of employees, etc. And if you are unable to qualify as a group, the individual direct pay market will be the market that will be available to you. And I think at this point I'd like to bring up Michelle Black, who is our administrator for your programs, and she and her team have been taking your phone calls and listening to the concerns, and I think she has just a few words she wants to say and introduce herself, and then I think after that we'll have I believe we're going to go, maybe we'll go Nick next, and then we'll go with Greg. So thank you very much, and Michelle, take it away.
Thank you, Frank. My name is Michelle Black, and I'm the Client Service Manager. I have been with Mercer, we were Marsh, and now Mercer this year, since 2009. And you probably I've talked to a number of you, and you've probably talked to a number of my teammates or some of my staff. Judith Kemp might ring a familiar name to you, Roger Viernes, and Denise Patterson. So this is a time of change. This has been very difficult for you. It's been difficult for us. It's been difficult to hear some of the stories we've heard, and it's because it's all personal. There are 3/4 of the block, of the New York City block. 3/4 of you are sole proprietors. You join the associations for the sole purpose, you're in the associations, but part of that was to get your medical coverage under a group plan. And you were allowed to go into the plan, pick up group coverage. You didn't have to qualify. You didn't have to have employees. And that has changed. And so now we find that our sole proprietors, because of this, now they're considered individuals. And because you're considered an individual, your plan has changed. Your options are different than they were before. So there is a narrower plan in that you don't have those PPO plans available to you in New York. You only have HMOs, or as we're going to talk about some other ones, EPOs available to you. And so this has been a really big challenge. Some of you are going through medical issues, and so and you're in your plan now, and right in the midst of this, your plan changes. So our team, we understand what your need is, and our goal is to find the best suitable option that is available to you. And all of the staff that we have, they're very talented, they're capable, they understand the plans, they can explain it to you. You will have those choices. You're going to have to look at those plans and determine what's the best one for you.
When is that going to happen? We're up against April 1st.
Well, it is happening now. So for sole proprietors, the packages will probably be coming out in probably sometime next week. We know exactly that's not going to change. It is what it is. If you're a sole proprietor, you don't have employees, you can't meet that eligibility standard, then your options are to pick up the Oxford HMO plans. We're also going to offer some other options with other carriers that are available to us, and we're in the midst of vetting that as well. So it has taken us some time to pull this together because we want to make sure we've done everything we could. We've looked at every market that was available to you. We've went everywhere. We've gone to everybody. We've brought in everyone to try to make this more fair. And when we go out with this package, we've done everything we can do. But we are brokers, and so our job is this point is to mine through that. Not just hit one, hit both of them. Is to mine through that data and find that plan that's going to be suitable for you. You are going to have some changes. Some of the doctors that you currently use today, you may not have available to you come April 1. So it's just something that it's a fact of life, and we're just going to have to find a better solution, the best we can find. Okay. So I just wanted to thank you very much for having us here today, and we'll answer any questions at the end. Okay?
At the end.
Okay. No, well, I'll answer your question.
In the Browns plan, high deductible plan, is there a point at which you take your deductibles and then you get 100% coverage for serious?
That it's the out-of-pocket max, and all of the plans will have an out-of-pocket max, so you're a stop loss basically, and you'll have that, yes. Yes. Okay.
You know, it appears to me that all the plans that you are offering require a referral where in the past we didn't need it. You know, that's sort of one thing as busy attorneys to try and get a referral to go to a specialist. Believe me, well, we all are working
Bus-
very hard
yeah.
and are very busy, and just with the administrative staff to call for a referral. So if there's, you know, anything you can do about that, that's sort of one issue that.
And I think that's something that our carrier friends here can actually address, because that is the way the plan designs work. And maybe there's something within those plan designs that, I don't know, that, you know, kind of mitigates some of that. Okay, there are a lot of questions, okay?
Let's hold them to the
Yes.
end. Yeah, let's hold them to the end.
All right. Thank-
Obviously, with the changes that are occurring, moving to the individual market, decision was made by the bar to open up individuals to other markets, and we have today Greg Trotta from Empire Blue Cross Blue Shield, which is an alternative to Oxford. And as I say, let's let Greg get through his presentation, and then I'm sure we're going to have a line of people asking questions, and we'll try to accommodate all your requests then. Oh, yeah. And then you down there somewhere.
Hello, everyone. Thank you, Frank. My name is Greg Trotta, and I'm here representing Empire Blue Cross Blue Shield. You know, as we said, you know, we've heard over and over on this panel, things are changing. This is a very difficult time for a lot of people whose coverage is changing, and Frank had asked me to come here to just present a different option. You know, as Nick had mentioned, other carriers are innovating and coming into the market again, and new carriers are coming into the market because there's opportunity here. And, you know, as individual members for the sole proprietors, we're hoping to present something that may be attractive to you. So, first thing I want to note is that for the individual market and the small group market, we now have what we call the Pathway Network. It is a more limited network than the traditional Empire network that you may know or may have previously had at another position or at one point during your career. The network is about 75% the size of our larger HMO provider network that we used to have, that used to be available to small groups. There's over 75 hospitals in the Pathway Network. To see if your doctor is in the network or any other hospitals that you may be concerned about are in the network, you can go to empireblue.com to check those. And this product is offered only to individuals residing in our 28 county service area. So we have a service area. If you live in one of these counties, then we could offer the product to you. I have a little bit of a map that could that shows you the 28 different counties. So if you reside in one of these counties, what we call rating regions, then Empire product is available to you. It covers most of downstate New York. So, if you live in Westchester, even, the Hudson area, or, downstate New York, Long Island, the city, you are eligible for an Empire individual product. I want to keep this brief for you guys, go right into the options that we have. Basically, this is our off-marketplace portfolio. So we have an on-exchange portfolio and an off-exchange portfolio. So this is for individual clients who come to Empire Direct. And as Frank had mentioned, if you come direct, you cannot get tax credits. So this is basically for people who are not eligible for subsidies or who don't want to go to the state exchange and get subsidies via the state exchange. We do have plans in all 4 metallic levels. So we have the bronze, the silver, the gold, and the platinum. And you could see the plans vary. I know someone earlier was talking about high deductible health plans. We do have plans with a single deductible of $5,800. So if you're looking more for that catastrophic coverage, then that's definitely an option for you. But we also have the higher end of the platinum with a $200 deductible and 5% coinsurance after that. So we have a variety of plans fit for different situations. We have HSA plans, so they're eligible for the health savings accounts and things like that. And essentially, the higher the deductible and the bronze level plans are naturally going to be cheaper than the platinum plans, and I have a little bit of pricing here for you. Well, first, let's talk about open enrollment. Frank had went over this. You could enter open enrollment and enroll into any of our plans up until March 31st, 2014. So essentially, you don't need a qualifying event, what we call in the industry. A qualifying event could be marriage, loss of coverage. You can enroll after the open enrollment period, provided that you have a qualifying event. Typically, we ask off-market plans applications be submitted the 15th of the month prior. So for a March 1st effective date, we request that your application be submitted by February 15th. And then I just did a little pricing for you. So you could see this is a New York City single rate. So just please, I want to caveat this, that if you live in a different area, the rate is subject to change. So this is if you live in New York City, so one of the 5 boroughs. These are the prices for our different plan options. The bronze plans, they range from about $350 range all the way up to the platinum plan, which is the low 600. And this is for a single. Obviously, couple and family rates are going to be changed. They're going to be higher. And one of the things with the Pathway Network, I just want to caveat that it is a smaller network, but that's reflected in the price. As you can see, the prices are very reasonable, and we've tried to create a different option where you could get affordable coverage, and if your doctors are in the network or you don't mind switching to a different doctor within the network, this is a great option, and it's really more affordable, monthly premium. And this is without any subsidy. If you qualify for a subsidy, that's great because your price could even be lower than these prices.
Sorry, I cannot see those numbers at all. Would you mind reading?
Sure. So for the 2 bronze plans, we have the CAAT plan, which is at $359.87 a month for a single premium in New York City. Then we have the bronze CABS plan, which is at $367.44 a month for a single in New York City. Then silver, we have the CBJW plan, which is at $427 a month, $427.33 a month for a New York City single. Then the CDIB plan, which is also silver, at $417.57 a month for a single. And we have the gold plan, CECB, at $518.56 a month for a New York City single. And a platinum plan, CAZD, at $615.61 for a single in New York City. No problem. So, that's really it. We have 6 different options, and we've tried to create something that fit every type of need. We do offer it in all different metallic levels. So, I'll be around here afterwards as well and here to answer questions. So if anyone has any specific questions, feel free to ask me. Thank you.